I
pretty
guess
exciting.
we know where we have to come beg, huh?
Well,
Nobody comes to our committee to beg.
That's not true. I've lost many times there.
Oh, that's true, you have lost. I shouldn't have reminded you of that.
these for you guys to share. His battle scars, man, what doesn't kill you makes you strong, right?
So we're talking about workforce capacity and I guess first responders. And
Right.
just introduce yourself and take it away.
Sure, Jeanette White, Senator from Windham County, Chair of Government Operations, and this is where we heard. So I'm going to say a little something here to start with, that EMS is kind of the forgotten sector of our state, I believe. Nobody really claims them. They are thought of as a transport system. They only, and that's the way they've been thought of for many, many years, but they really are an extension of our healthcare system. They're not transporters. And so no committee really has had jurisdiction over them all and has worked with them. But about what Senator Clarkson, I would say maybe 5 years ago, 6 years ago, Drew Hazelton had a meeting down in Brattleboro and said, we really need help around certification requirements, continuing education, all kinds of stuff. And we started working with them. And we've managed to do many things for EMS. And now they were in bad shape before. And now because of the pandemic, they're in even worse shape. And one of the problems is they rely a lot on volunteers. They only get reimbursed when they transport. So if you call because you fell and hit your head and you call, but you say, nah, I'll take myself to the hospital. I don't need to go to the hospital. They don't get paid for that. They only get paid if they transport you to the hospital. So they have a lot of calls and they do a lot of fundraising on their own, and towns also are billed and paid. So they really need help. And the other thing that has happened during the pandemic is that they've been hosting a lot of the vaccination sites and a lot of the testing sites all over the state, and they have been filling in hospitals because the hospitals are shorthanded. So the EMS people are going in and working in the hospitals, the paramedics. And then what happens is the paramedic says, whoa, I'm making twice as much working for the hospital. So they leave the rescue system and go to the hospital. So they are in desperate need of recruiting and helping to pay. And right now, well, we know their reimbursement doesn't cover their costs, and they also have to pay a provider tax to the state, and that impacts them in a negative way. And volunteers, these are volunteers for the most part, are asked to pay $500 or $800 or $1,500 for their education, and then they're volunteering. So they're constantly losing people, and they need more help. So I am begging you that we asked to put it in the budget, but they decided it was a workforce development issue and this is where it belonged. And so what I think you have in here, and it would cover many, many people. So it isn't like it's just helping a few people. And the ones on the top add up to about 590, but the two on the bottom, the child care, the critical care paramedic education, and the EMS continuing education, those cover all the people who are currently licensed, and that's 2,600. So this amount of money is covering well over 3,000 people. So that's the story, and they are in desperate need of this money.
So forgive my ignorance in this. So there is in statute, there are EMS districts in our state?
Yes,
Yeah.
yes, we have, and we actually worked with them on those districts. Here's a map of the districts. There are 13 or 14 of them they're organized around hospital catchment areas,
Okay.
and then
Not
there's,
by county.
huh?
Not by county, by catchment area.
By hospital catchment area. And and then there's an advisory council so that each of them has a member on the advisory council.
So what's the governance? Is it like each town sends somebody to a board or something?
No, it's not, there are so many variations of EMS in the state that it isn't consistent across the state. Like, for example, rescue in Brattleboro covers most of the towns in Windham County, and they have representatives on the rescue board. Some places are completely voluntary. We heard,
And some places are completely professional.
well, no, I don't think there's any place that's completely professional. They all have volunteers in addition to
They all
their-
have volunteers, but there are a bunch that have a professional course
Well,
that,
that's what
Yeah.
yes, rescue is that way. It has, we heard really compelling stories from volunteers. Margaret Lagos was one of them. Just, I mean, she sleeps she's a lobbyist and she sleeps in the rescue office so that she can be there, and then she comes to Montpelier to do her work, and then she goes back and sleeps on her on-call days. So anyway, it depends on how they're organized, and then some are completely volunteer, some are professional and volunteer, some are run by the towns themselves. It's a mishmash all over, but they all have representatives on this advisory council, every one of the 13. And I can give you a map if you want to see what the districts look like.
So if we were to do all a part of
Yeah, I
this,
just have
who would we give the money to?
that was my question.
It would go to there's an EMS section, I don't know if it's a division or what, in the Department of Health. Dan Batesy is the person in charge, and Will Morin is the new on-call person there. And it would go to them, and I believe that's how it would be distributed.
Right, and then they would distribute it as we identify.
Yeah, and they came in and testified, and they are in absolute agreement with all these numbers. And they, the critical care paramedic education is really important. It does a lot of, childcare, so you need to have different training if you're gonna be an EMS person that deals with a child, then, because they're not just little people. And also that continuing education is really important. And they have about 3,000 people who go to the annual conference. And so many of these are volunteers, and even if they're not volunteers, Rescue in Brattleboro, I believe, starts their salaries at something like $13 an hour. They can get paid more for being a dishwasher at $99.
Which is part of their challenge and why they're having such a hard time recruiting people.
And it's hard work, and it's really exhausting work, and they, in my opinion, they are one of the groups of people that is, I'm not sure how to say this, probably the most honorable people. They see us at the very worst times in our life. They come into our homes when we need them, and they see us, and yet they have a level of professionalism that is just incredible. We have had them at our house, and when you go to the grocery store and they see you, they don't even acknowledge you. I mean, they are very, very professional and very underpaid, under-resourced, and they also lost a lot of money during the pandemic because they had to constantly be cleaning their equipment. So, and they didn't get any reimbursement for that. So they had to constantly be using very specific cleaning products on their equipment because they couldn't use just anything because it would eat into it would corrode.
They
So-
did get CARES Act support for the COVID sites though, for all that work on setting those up and staffing those.
But not for their supplies or for the supplies for the COVID itself,
Yeah.
but not for the equipment and not for the cleaning equipment. And,
So would you feel comfortable if we funneled the entire amount that we decide to go to Dan Batesy, the EMS division at DOH, to have them in conjunction with the council to make the decision about where best to, how to prioritize and how best to spend.
This is the way they should do it. This is what we're asking.
I get that, but if we don't do the whole 950, if we do something more modest, that we would charge them with the council to prioritize the spending of that money.
I guess you can, and I am saying that there is a lot of money in workforce development for a lot of different places, and there's a lot of money in this budget. And this is a measly $1 million that will save a system. We're not just talking about helping the people here. If they don't get the kind of help that they need, the entire system will.
It's a system in jeopardy. There are two of us who are very clear.
Yes, and so I don't know how else to say it, but they need the entire amount of money. They cannot. Last year they were given money and it did pay for a lot of training and workforce development for them. There was also an amount of money, $500,000 in the budget that was to go to VTC for EMS training. And the way it was worded was that if they couldn't spend it all on EMS, they could use it for other programs. And they only used 240 of it for EMS and the rest of it went someplace else. And we can't get any responses from VTC about why they didn't give it all to the EMS system.
Right.
So anyway,
So just,
Yep.
where do they get their resources?
What
now?
resources?
From the state? Where do they get their money? Towns, individual towns?
well, they get it from a number of places. If they transport you to the hospital, they get reimbursed from Medicaid, which, as we know, Medicaid reimbursement is always way less than it costs to
Even
provide the
for
service.
non-Medicaid patients, they get paid a
No.
Medicaid rate? Okay.
No. They can get from private insurance.
Okay.
They do bake sales. They
Booth drops.
they sell subscriptions. Like we pay a certain amount every year to be a member, and then that means that if we have to use rescue, they will charge our insurance company, but they won't charge us any difference. And they raffle off cars, and they and towns.
Towns support them. Woodstock supports its EMS division.
It depends on how it's organized and how it's in our area. Each town is assessed based on population. It could be different in the 13 districts depending on how they're organized. So they get their money there. They get it from mainly it's
patchwork.
reimbursed, but they never get enough to pay for what they.
So last year, the legislature in the budget put money in
Yes.
only through VTC, or did they get some?
No, they got some money also for education and for
So
training.
is that ongoing, or was that?
No, it was one time.
It was one time. It
And
was
that's
our
why they are in desperate need of this. And they are losing people. They lose more people than they gain every year. And this would pay for, if you can see that under the initial EMS program, it would pay for 460 students. That's a lot of new EMS people. And we worked with them to set up, we redid the levels of training. So there's now a real first responder program, and that's what the initial EMS is. It's a very first responder.
Right. It's an entry level
Yeah.
position for.
And we worked with them around, it seems very simple, but when they bill an insurance company, the insurance company is supposed to pay them. But in many cases, insurance companies were paying the client, the patient, and the patient would never pay the EMS service. So we worked with DFR and said, you have to enforce this. And 5 insurance companies last year were dinged for doing that, and now they're not doing it anymore. So just little things make huge differences to the EMS system, and that's why it is kind of so forgotten, because they don't make big splashes, and they don't really have they don't have a lobbyist.
They have this one EMS chap who really spends way too much time working with us in the state house when he should be working in Wyndham.
Yeah, that's true.
This
He's
is
the
true.
head. He's the head of our rescue down there, and he has been a dog about making sure that he's the reason that our committee 5
Yes.
or 6 years ago started taking this on, because no one else in the state house was.
They really fall through the cracks, and even though they have sort of a czar embedded in DOH, it's in Dan and now Will, right? Is Will running it now? Will Moran. It is, and working with the council, that is it for coordination. I think it's just a staff of one, right?
Yeah, it's
And the council.
and they oversee the certification process, and
Sit around.
So, I don't think Senator White can necessarily say where she thinks the money should come from in the overall bill. I still believe that we have not heard compelling enough testimony around paying for preceptors when there's a patchwork of compensation for preceptors at different hospitals in the state. We wouldn't actually even need all of the money in the preceptor appropriation. I feel compelled by that this amount of money is quite spelled out. That preceptor money goes to the hospital to add $5 an hour to, we don't know how many people for who are doing this or aren't doing this. I would move or whatever, I don't know.
We're just beginning discussion.
Okay, well, I know we have to move it, this is Friday, so.
I know, but we're
You
not.
know, I'm just saying, I would propose that we look at that fund and try to fund as much of this as possible. That's where I'm at.
And so is there credentialing requirements for these folks?
Yes.
in the
yes,
law?
there's, and that's what I said, we work with different levels, so there's a very beginning level of entry level now that's been just newly established, and they have,
Which
last year they trained, I think, 200 new people in there, and then they go on, and then there's an EMT level, and then a paramedic level. So there are different levels, and there are different certification requirements, and they have to take tests. They have to be certified by a national organization, and they have to be certified by the state. We've worked with them to make that consistent, so they don't have to be certified by the state, and then the next year certified by. So we've been working with them a lot on a lot of different issues. This is just their request for training and education
Right.
money,
training
and
and
they,
continuing education,
Yeah.
early training.
Yeah, I didn't know what an EMR was until, I got here this morning, and that's what I've been looking at.
Right.
It's the difference between an EMR and EMT, and
Right.
advanced EMT and a
So
paramedic.
there-
It's my-
So
Responders, I think.
you keep mentioning certification, but is it effectively a license? You can't work in this area unless you have
well,
a
there are
certification?
different levels and different things you can do. For example, the requirement was that they had to have, before this, that they had to have 2 licensed EMT people in the front of the truck, right, in the front of the ambulance. And then somebody's in the back. Well, that was ridiculous. So now they can have an unlicensed driver. We've been working on all of these issues for 5 years, 6 years. So that now they can do that. So now they don't have to have 2. So there are different levels of certification, and yes, they are, and they're certified by the Department of Health, not through OPR. It's through the Department of Health. I will tell you this, that my plan is to work with Drew over the summer and with the advisory council to try to figure out a way for them to have more sustainable funding. And
We need
one of
that.
my thoughts is that the hospitals should have a line item in their budget for emergency services, because we can fund all the nurses we want, but if this person dies, they won't have any patients anyway. I mean, So this is the kind of the spine of the healthcare system as far as I can tell, and yes, we don't ever recognize them.
It's certainly a key and poorly reinforced and underfunded, essential pillar of the healthcare system. Michael, its credentialing is very similar to, it's a very clear ladder of who can do what, and I think there are 4 levels. You start at the early EMS or
No, I think
EMR,
EMR
and then
is
you go up to
is the
EMT,
one we
and
developed.
advanced EMT, and then
Is there some overlap with fire departments? I mean, I have.
There are-
One situation I had in my life, which was very sad, and the fire department came, and
It depends entirely on the town, how they want to do it. The town of Brattleboro just pulled out from rescue, which is one of the worst decisions ever made by the town of Brattleboro. But their town manager has decided that they should have it done by their fire department from now on, because they can generate an additional $500,000 to $700,000 for the town that way. Well, if the rescue has to have bake sales in order to fund themselves, I don't know how the town of Brattleboro thinks that they're gonna get an extra $700,000 by doing it, but that's their choice. So some places,
so it's not overlapping, you can do either or.
it can be either or, and in some places, the fire department responds also, like in our town, we have a volunteer fire department, and if you call rescue, the first person that arrives at the scene usually is the first responder from the fire department. But they are first responders. They can't administer any healthcare like the EMTs can. So it's different levels, and they, but it's not an overlap in funding, believe me.
Yeah, it's not, in some towns, I mean, there are the professional teams in the biggest towns like Burlington and Hartford and Springfield. And they're still separate, even though they tend to be embedded in the same office. I mean, in the same buildings. I mean, like our fire and EMS are all in the same building. Separate calls, separate responses, but it's.
Did anybody, Senator White, make this pitch in the House at all, do you know?
Well, like I said, I think that the EMS, the system, is ignored by most people, that no one assumes responsibility for it. The healthcare committees never deal with it. And it's only a fluke that our committee started working with them, and it's only because of Drew Hazelton. Because I know
I
him
was gonna say, and Jeanette.
And Jeanette is really the only reason this is happening.
No, it's Drew had a meeting with all of the Windham County delegation 5 or 6 years ago. And he had his charts, and he said, we're about to die. And we said, what can we do? And since I'm a committee chair, I said,
This is what we can do.
and our committee tends to be, as Senator Collimer likes to call it, not the healthcare committee, not the transportation committee, but he likes to call it the surprise a day committee, because we do whatever nobody else wants to do. And this is one of those, huh?
It touches on government in
Or
some
that
capacity. Or that doesn't.
And
But I think-
so I think that this particular area is one that falls through the cracks everywhere. And until we can get it acknowledged as a real part of the healthcare system, it will continue to fall through the cracks. And that's why I'm here. And if it helps, I will get down on my knees, or I will lay on the floor and kick and scream.
So I think the answer to Michael's question is no, it wasn't dealt with in the House. The Windham County representative on healthcare came after that plea from Drew, and she may not have been up to speed as fully on this. So it really is the champion for EMS, quite frankly, is Jeanette. And so you're right. Had we maybe been a little bit more understanding that the healthcare committee up there was going to be making so many focused recommendations to Commerce, I think we probably would have gotten our bodies up there. But at the moment, it's being introduced by its champion, our own Jeanette White. So
I'm also concerned about the fact that not all the money went to EMS last year through BTC.
Well, we're trying to figure that out, and it honestly did say in the budget, and I read it, it said $540,000, and there's the same thing in there this year for $540,000 to VTC for first responder training and others if they can't spend it there. So we have been trying to get someone from BTC to come in, but I don't wanna penalize the EMS system because of an action that BTC took. And they are very busy with their reorganization and everything that the state colleges are going through right now. And so we haven't been able to get anybody in.
So-
And even if we did get somebody in and they explained why, it shouldn't impact this.
So, but you just said something that is, of course, we have to ask you as a follow-up, which is, you just said that 540,000 was in the budget this year, FY '23, to go to
For
BTC.
for BTC, for all of their kind of, I
EMS.
can't remember how it's worded, their technical, their career kinds of programs.
So
It's for
not
all
just-
of them, it's not EMS.
Right, okay.
And
I was gonna say, otherwise we would not, we would only. need
no,
400,000.
this
Yeah, I know.
funding is nowhere. There aren't $2 of this anywhere in anybody's budget.
And part of our, this is raising awareness, and this is.
And here's an example of how they're kind of just not part of it. And I think that the advisory council became more active once Drew took over, and we reorganized the 13 areas, and we did a lot of work around that. And the representatives on the 13 areas and on the advisory council. And so every year they get a very small amount of money from the, that comes from, I want to say the universal service fee, but I'm not
Universal
sure. And
Service Fund.
but it's a big chunk of money, and most of it goes to ski. Most of it goes to the fire departments. And a very small amount of that money goes to the EMS system every year. But the amount that goes to the fire department way outweighs, and I can't remember the exact numbers now, but it's from, and I can't remember the name of the fund, but it's not much money that goes to the EMS. So this money goes out to them, and it's small. It's like a couple $100,000 a year for the whole 13 of them. What's happened over the past is that the Department of Health had such arcane, bizarre requirements for getting that money that it wasn't going out. So there's $576,000 that was sitting there that should have been going out all the time. And we had a hearing and said, get that money out, and if we need to legislate the parameters and how you're gonna do it, just do it. And it had been sitting there for a few years, and last week we had a hearing with the Department of Health, and they're getting it out. So part of it is awareness and the fact that this system, nobody acknowledges it. So I don't mean to take so much of your time,
That's fine.
No,
but
this is great.
We've got two members of government operations here as well.
I know, and
That's for embedded.
I think that Senator Rom Hinsdale is right, that there is money in here that is not as well defined in your whole thing.
Right.
And I'm not sure just the nurse preceptors, but that is,
That's our next step, is working that all out.
and
So
where this money comes from, and I'm begging you to do the whole amount.
that message has come through loud and clear. So thank you. And we're continuing to work on this, and we're gonna now move to another area of healthcare after this terrific presentation and compelling presentation. We're now gonna move to Green Mountain Care.
Hopefully I'm
No,
gonna
no,
take it.
you didn't bore me.
I feel like Jeanette's not gonna leave the seat.
I'm not gonna leave this in until you give me my money. Thank
Calvin,
you.
would you be kind of give Jeanette her so that she will
This
leave
is
us
the
alone?
cue to,
Give that woman the hook.
Give that woman a hook. Okay.
Thank you.
Thank you, my dear. This is great. And
Thank
we've
you,
been working
Sarah.
on this since I came to GovOps.
Yeah, we've been trying to help this forgotten system.
Yeah,
Thank you.
key piece. I forgot. Key piece of our system.
Yeah.
Good morning, Susan and Christina. I don't think I know Christina, but I certainly know Susan.
Good morning.
Welcome.
So Senator Clarkson's leading this workforce effort, so go ahead.
Well, and you don't often appear in our committee, healthcare advocates. So I assume you know most of us, but Christina, I don't know if you know us, so let's just introduce ourselves.
Hi, Senator Keisha Rom Hinsdale from Chittenden County.
Allison Clarkson, Windsor County District.
Michael Surratt from Chittenden County.
And Randy Brock, Franklin County, has just had to step out, but he'll be right back. So today we have had, and I assume you testified in Senate Health and Welfare about the sections that are in H 703 that pertain to the Green Mountain Care Board, because they have included you in their amendment to us. I think we're talking about sections 30, 31, and 32 maybe. I think you're in 3 sections, is that right? And 32, no, maybe not.
35, 36.
And 35, 36, thank you. Yes, Scott, thank goodness. So we're looking at sections 30, 31, 35, and 36. So we would love to have you chat with us about these and what they mean to you and how important they are. They don't come with money necessarily, but they do, they have been included for reasons we'd love to have you further flesh out. So take it away, Susan, or
Great.
whoever wants to.
Perfect. Thank you so much for inviting us in. I'm Susan Barrett. I'm the Executive Director of the Green Mountain Care Board, for the record. And I'll have Christina McLaughlin and my colleague Christina introduce herself.
So,
Thank you. Good morning. My name is Christina McLaughlin. I'm a health policy advisor at the Green Mountain Care Board.
So we are prepared to comment on those sections you listed, and there might be one other section at the end if I have a moment. I think it was section 34 that I just wanted to add one quick comment to. And I just want to say up front, my dog is in my room with me. He's just gone blind. So if he barks, I apologize. I just have to keep an eye on him because he can't see anymore. So if he does bark, maybe Christina can take over, but he's usually pretty good. So first, section 30, and I'll just state the summary of the section if that works out for you, Senator Clarkson. Does that work?
Great. We've got it here. It's section 30, Green Mountain Care Board Hospital Budget Review.
Perfect. And in summary, this section directs the Green Mountain Care Board to review hospitals' investments in workforce development initiatives, including nursing workforce pipeline collaborations with nursing schools and compensation and other support for nurse preceptors. It also directs the board to consider salaries for hospitals' executives and clinical leadership, and the hospital salary spread, including a comparison of median salaries to medians of northern New England states. So this section, the board, supports this language. Currently the board requests the hospital's 990s. We take that information and we put it into a chart that shows anyone in the hospital making over $500,000, and we post that on our website, and that's accessible. We can share that link with all of you. We also, in terms of this section, we do support it, and we also really support the hospitals, directing investments into workforce. Chair Mullen, who unfortunately couldn't be here today, he has another engagement, has been supporting healthcare workforce since day one. And he knows that having the supporting nurse preceptors is really addressing a major roadblock in terms of education of our nurses.
So may we ask you, nurse preceptors have been of interest to this committee, because I think we are not clear why the state should be paying for their compensation, given that it's a piece of education. And it strikes us that the educational institution that is that the student
Or the
nurse,
hospital itself.
or the hospital itself.
Some are.
The educational institution and or the hospital should be paying for this and not the state. So that is really our question for you. Why should we be paying for that and not it be embedded as part of their educational costs?
So I will comment on the hospital side of this. The education piece I'm not as familiar with, but and this will bleed into another section that we'll comment on in terms of the hospital budgets. We weigh the investments that these hospitals make in workforce, education, preceptors, et cetera, and that it is a tension between affordability and access. So we want to make sure the hospitals are solvent, but we also want to make sure that Vermonters can afford the care at the hospitals. So at the end of the day, who pays? It's the folks who pay their claims for healthcare. It's the folks who pay into Medicaid. It's the folks who pay into Medicare. So I think we're all paying if it's coming out of the hospital's budget.
We're all paying if it's coming out of our budget.
Yeah, and we're all paying if it's tax. I mean, we're all paying either way.
Exactly.
I mean, if it comes out of the state budget or the hospital budget. I guess then a follow-up question. So where do you stand on the educational institution then paying for the preceptor addition?
I don't feel like I can comment on that. I'm not as familiar with the educational system as I probably should be. So I don't feel like I could comment on that. I personally, I think that it should be a shared responsibility for all of us, because the preceptors, that is, as I said, a major roadblock, and how you pay for it is a decision, obviously, for all of you, but it does impact all of us.
Okay,
If you don't
thanks.
have the preceptor,
Keisha has a follow-up question.
So Susan, I understand the question between access and affordability, but if we're talking about a crisis where this is a major roadblock and some hospitals are covering this cost and some are not, and nurses have asked in their bargaining for this to be covered by our teaching hospital, I feel like you all have a responsibility to direct this to happen. I have no problem putting in this bill that hospitals need to start covering this cost, because just putting in $1.4 million is not going to do very much anyway. So I think it's silly for us to thankfully to put $1.4 million towards this when it's a much bigger systemic issue. And I think it's embarrassing that our teaching hospital is not already compensating nurses for teaching new nurses on the job. So I don't know what the Green Mountain Care Board is doing about this, but it feels like if this is a major roadblock, that's your responsibility to figure out why there's a patchwork and some hospitals are compensating and some are not.
Right. I think that's generally our concern as we listen to this section, or to the whole preceptor issue.
We're not just throwing $1.4 million at a big problem.
Yeah,
That's
no,
silly.
no.
That's a waste of money.
Exactly, and I think that's sort of our big concern. And I guess the other question I'd like to know is what are the other areas in this bill? We have a whole section on upskilling entry-level healthcare workers, upskilling them and continuing to engage them with a healthcare career. And I assume you support that section. But other than that, I'm not sure what additional workforce the hospitals and Green Mountain Care Board are actually invested in.
So that's a great question. Let me start with the Green Mountain Care Board and our statutory responsibility we approved the healthcare workforce work plan, which we did this year. And actually the board directed and it impacted significantly many of the recommendations that came out of that plan. And I was happy to see that many of those recommendations landed in H703. And broadly speaking, and I'm agreeing with you that the board does have a role to play statutorily. That is in black and white print, but larger picture, when you look at the board's mission to make sure there's access to affordable healthcare for all Vermonters, if you do not have the workforce, then you do not have access to that care. And so that's the way we've framed our work around on healthcare workforce. We do not have like some other areas of government, we do not have a budget per se, a budget at all to give to any institution in terms of funding. That funding would have to come from the hospitals themselves, which they have stepped up and provided some, in fact, quite a bit of funding for building or growing their own workforce. But that our role is prominent in terms of making sure that healthcare workforce is addressed. And we know that, and if you go back 5 years, I'll say our Chair Mullen has been laser focused on this. That said, we do not have as many levers as other parts of the system in this issue.
So thank you, Susan, that's helpful. So you could, however, and I suppose we could in conjunction with you, require that each hospital have a workforce development plan. Do you already have that requirement?
We do not. Nothing in statute. I think this
because if each hospital is responsible for financing its own healthcare workforce development, if there isn't an expectation that they're doing it, I'm not sure how that's going to happen. Anyway, so thank you. So that is it. So Section 30 just directs you to review these investments that you're already doing. Aren't you already doing this?
Yes, we are.
So is this necessary? I mean, you're already
we would do it anyway, as you said. So, we certainly, the part on the addition of the second part of considering the salaries for hospital executives, that is more specific than what we are doing. We do not in statute have the direction to post the 990s. That is something that Chair Mullen wanted to do when he first came on board. So I would say that is an addition, and this is just more specific.
Right. Okay. Right. How about Section 31?
So in addition, and I think this bleeds into the same type of conversation about that access and affordability. So we are okay with this language, and this is a perfect example of something that we already do. So we take into consideration the financial pressures facing the hospitals, and we consider the investments that the hospitals are making in workforce. We've done that over the last, let me just back up, even before the pandemic, this was a crisis. Right. So we've been focused on bringing this issue up in a transparent way and asking others in government to help us address the issue, as well as the hospitals, and the hospitals have stepped up as well. So we already do this. This is May language, so we would want to make sure that it was kept as May language. This is the same issue of that affordability and access issue. So if we are allowing these investments to come out of the cap that we provide, that we set out in our budget guidance, then that is still pressure on the system, that those are still dollars that consumers will still have to pay for healthcare. So we just want to be mindful of that. And we are fine with this language. As I said, we do this already.
Right, okay. Any questions on section 31? Okay, sure.
I mean, in an overarching sense, so much of what we're hearing is about the cost of traveling nurses, and that it's really, it feels hard to blame costs associated with hiring more full-time nurses for any kind of access or affordability issues when we have full-time nurses who feel like it's a better deal for them to become a traveling nurse. So I don't know what you all are able to do about that or what's happening there.
Yeah, I can give you an example, and we'll hear this summer during our hospital budgets, and certainly you should talk to this specific hospital, but we are particularly interested in what Southwest Vermont Hospital in Bennington has done. Anecdotally, I have heard that they have not had to hire, and I don't want to say any, but very low amounts of traveling nurses because they invested in their workforce previously. And again, I don't want to speak for them, but we're very interested in learning more about this and how they can share their best practices with other hospitals, because I can't agree with you more that we need to invest in nursing and our nurses and their salaries as full-time nurses and move away from the travelers as much as possible, because it is, while they're necessary, they are not a long-term answer, and we cannot afford, it's just not a sustainable answer to the workforce and nursing crisis. And nurses deserve to have that pay that you know, they're just a cornerstone of our workforce. My sister's a nurse. I see how hard she works. I'm very committed to nursing personally. And I know the board is also very aware of the work that the nurses have done over the last several years and even before that.
Is there anything of value you think we could do in here in that regard, or that wouldn't really help you in your exploration of best practices?
No, I know we'll take, I don't think so. Thank you though. Thank you for putting that out there. We are going to be talking a lot about workforce. As you may know, we recently had 2 hospitals ask for mid-year rate increases.
Yes, we are well aware.
Yes. So that was somewhat of a preview, I believe, to what we'll see this summer. And we need to continue to work collectively, the state of Vermont, the education centers, the hospitals, to make sure we grow our own. And I know many of the hospitals have started doing that, and support the current workforce so that we don't have to rely so heavily on travelers.
Okay, thank you. I think we need to move on to the additional sections that Green Mountain Care Board is named in.
Great.
35, 36, but I think you wanted to touch on 34 also.
I did. Before I turn it over to my colleague, Christina, section 34, and I don't have it in front of me, but I believe it's a position at AHS to really make sure these recommendations and this statute is implemented. We are very supportive of that. There needs to be somebody who has this as their charge and be a champion of moving these recommendations through the state system. Otherwise, I fear that they just won't have the attention that they deserve.
So you view this as sort of a coordinator for all healthcare workforce?
I would hope that they would have a high level view of all healthcare workforce. And again, I don't have the language in front of me, but I thought of it this morning, and I said to Christina, I do want to comment on that section, because we know how important it is to have a champion to make sure these initiatives move forward successfully.
Okay, great. Yeah. point well taken. Coordination is a key problem for us here with all this patchwork of workforce. So sections 35 and 36, Christina, you want to chat about those?
Sure. So section 35 and 36, we are not the main focus of these. We are in collaboration and working with other agencies at the state, but section 35 just quickly directs the Department of Labor to collaborate with us to explore and recommend to the legislature a process methodology and the funding necessary to establish and maintain the capacity to perform a healthcare supply and demand modeling based on information in the Healthcare Workforce Data Center. This would be due January 15th of 2023. And then section 36, relating to the Green Mountain Care Board work, it tasks DFR to direct health insurers to provide prior auth information to the department in a specific format to enable the department to analyze opportunities to align and streamline prior auth processes. And these findings are then shared with us, the Green Mountain Care Board, and then the department and the board will collaborate to provide these recommendations to the legislature on or before January 15th of 2023 regarding any statutory changes necessary to align and streamline prior auth processes and requirements across health insurers. We did work with Representative Donahue and others in the background on this language. So we support this language. We're happy to work with DOL on the supply and demand modeling and work with DFR to provide recommendations to the legislature on these prior auth processes. And so we support this and are happy to do the work.
So did DOL give you a notion of how much this additional work would cost?
So there were some.
And why isn't DOL doing this already? This is a key piece of our workforce in Vermont, is our healthcare workforce. So I would assume because it's jobs in Vermont, they were tracking this.
And I believe they are doing some work to a certain extent. I know that and this is why we didn't comment on the healthcare workforce data center, but this is why there is language and money to support the data center, because there is workforce data in a lot of different areas. I know AHEC and DOL and other areas collect this data, OPR as another example. And so having that all combined into one data center, of course, that work would be under AHS, the Director of Healthcare Reform. So that's not something that we are here to talk about today, and that's definitely a question for them. But you are right, and I believe DOL is doing some sort of work or has done supply and demand modeling sort of work in the past. I think there was money that was appropriated to them or someone else, and they had a contract perhaps, and I don't want to speak for them, but I believe there was some discussions that this wouldn't be completely new, but this recommendation came directly from the Healthcare Workforce Strategic Plan that the board approved. And so this is just to explore, the process, methodology, and again, the necessary funding to establish and maintain this. And then this data would help inform the Green Mountain Care Board's some of our work as well. So we definitely
Michael.
So who's in charge here in section 35? Department of Labor?
Yes.
And why should they be in charge? Why we're establishing a new position to be in charge of coordination in the previous section? Why is that person responsible for doing this?
Well, I think to the comment earlier, DOL does collect workforce data. So and I think that this is something that they're familiar with doing in the past. And again, I don't want to speak for DOL, and I know Matt Barowitz was in the other day, and I think maybe briefly touched on this, but I'm not sure if his follow-up included anything relating to this section, but I think this is just what made the most sense. And like I said, there were some background discussions with Representative Donahue and others, and DOL was seen as the best agency at the time to take on the supply and demand modeling and working with us, because we don't really collect workforce data at the board. We house other data, but we do not specifically collect workforce data as it would relate to this. And this would be a big undertaking. I don't think we can ever pretend that data work and modeling is easy and and cheap. But if you want to do it properly, I think DOL was the the best department to lead this work.
DOL is already doing some of this, and I think it would be great to hear from Matt what additional resources they need. I don't see the money here for this.
No, and I know that Senate Health and Welfare had commented that perhaps in the future money would need to be tied to this. But right now this is very exploratory. And like I said, it was a direct recommendation from the Healthcare Workforce Strategic Plan. So I think this was just a simple add to the language to make sure that the work is getting done and it's moving forward, because as we just talked about, there is no real champion to make sure that those recommendations are fully moving forward. There were a lot of recommendations. So that's why a position would very much be helpful for that work, because we all know the Director of Healthcare Reform is very busy. And this was that strategic plan work was a big undertaking. There were a lot of stakeholders involved and a lot of meetings. So I think that with all of that said, this language was just, I think, a good one to pull from that strategic report to make sure that this work is being done.
Thanks. Because I think some of that's duplicative with what they're already doing, and the question is how much do they need to expand it, and
right.
And what
right, and that we want to make sure this is not duplicative. We know this is to collaborate to see what the process and methodology and funding
and how to
would
expand
be.
on it. Right. So I guess one of my questions is, if you support this, a coordinator, how does that job interface with the Director of Healthcare Reform, or
I believe
the position you just mentioned?
I believe the position is in AHS and the Healthcare Reform Office.
I think it report to,
Yeah.
I think this position would report to the Director of Healthcare Reform at the Agency of Human Services.
Right.
But I wouldn't want to speak for AHS either.
Okay.
Have either of you seen the language that Senator Lyons provided to us yesterday?
Yes.
Yeah, they were, I think it's all.
Okay, so are you in agreement with their proposal? Do you have any problems with their proposals?
Well, I mean, their proposal didn't tweak any of our sections or the sections we're here to talk about. The other, I mean, I will say, I think I quickly briefed, I take a brief look at it, and I know there was some funding changes and some sections added. And, as Susan said, the board supporting healthcare workforce. This has been an ongoing topic at the Green Mountain Care Board. And since 2018, when Chair Mellon came on, this is something we've been meeting about, talking about. It impacts our processes, especially the hospital budget process. So I think as long as we're moving in that direction of funding and supporting healthcare workforce, you definitely can't go wrong. But obviously it's costly, and there's a lot of folks that have to be involved in that work.
Great. Thank you.
So I don't know if you were listening in at all on Senator White's testimony, but do you at the Green Mountain Care Board ever hear of any issues or problems with EMS workers? I agree with Senator White. It is sort of part of the whole healthcare delivery system, and I would assume the Green Mountain Care Board would be concerned if there was problems percolating or developing in bringing people to the hospitals.
Yeah, I'll comment here. Christina may have, she follows miraculously so many conversations. I did not hear that conversation, but in what you're saying, Senator Shrotkin, we would certainly want to make sure that, I mean, that's an access issue, right? If folks can't get to the care that they need, especially in an emergency. So we certainly would support increased access to care.
Right, but have you heard of any problems in this area? Has anybody approached you and said lacking in resources, we're not getting to people in time, there is an access problem developing, or there's a workforce problem developing?
Yeah.
I mean, I assume that given your role, that you should have heard, or you would have heard about it.
I have heard in the past, we have heard in the past about issues around EMS and support and the need to support their work to support the access. But, you know, again, in terms of a regulatory oversight role, we don't have a specific role, but I think that falls under the umbrella of our mission of making sure there's access to affordable, high quality healthcare for all
There's
Vermonters.
no access if people aren't bringing people to the hospital. So
Exactly.
I think that's
Yep.
our, yeah.
Yep.
I think they're an orphan that needs, and particularly because you're old, most of everybody is coordinated in somehow through AHS. And it does strike us that there needs to be much more coordination to make a seamless healthcare system, delivering patients, responding to patients in their homes, bringing them to the hospital. That seems like a key entry point for the system that we need to be addressing, and we're going to be addressing their workforce needs, as they, you know, they're a system under enormous pressure, just like you. But because they rely on volunteers so much more than you do, you have high-paid professionals. They have low-paid professionals and volunteers. So, and yet your system depends on their ability to bring the customers in to an unaffordable system. Affordability and access. We've just identified two areas that are continue to be our challenge.
Where, in terms of their funding, their support level, EMS, one of the key things I heard was that they get Medicaid reimbursement and they get insurance company reimbursement. Do we need to talk to DFR about that, or AHS? I mean, is the insurance reimbursement, if insurance reimbursement was adequate, I would think that there wouldn't be any problem in their funding. But it sounds to me like that may be lacking.
Well,
How do we make sure there's sufficient reimbursement for delivery for the ambulance services?
and for the trips to the homes where they don't end up transporting. So I think that's a bigger conversation that we probably need to have. I think we have our next witness here in the room. So if you have anything further on these sections, or if we have any further questions, I think the EMS one is a continuing question.
Yeah, and I'll follow up and listen to that testimony. I apologize, I haven't heard it. And so if any other comments, I can help them.
If you had any response on that, Susan,
Yes.
we'd really appreciate it.
Absolutely.
Thank you very much.
Thank you.
Thank you.
Thank you.
Have a great day.
We are working on it. Friday. That's a start. So, Senator Campion,
Good morning, everybody.
good morning. We are
It's an
here.
absolute honor. You know, I don't get invited to many committees, so this is one of the highlights of my week.
Yeah. We are thrilled to have you.
Tangerines and chocolate.
Chats last night with the highlighter.
Yeah. So, Senator Campion, you have some workforce development issues that relate to education. So if you'd
That's
be
right.
kind enough to introduce
Sure, and I'm
yourself
told,
and your concerns.
Sure.
And the areas.
Mr.
action.
Hall is supposed to be joining us, so, David Hall,
Oh, he is? Great.
yes. So, Brian Campion, Bennington County and Wilmington, thanks for, is that okay that I asked David Hall to join us? Is that, I see a lot of back and forth.
No.
No, we're just delighted.
I feel like I'm already making a mistake. Sat down.
Nope.
Don't be so paranoid. You're welcome here anytime.
We love having you here. We love your compost. We love you.
Thank you.
Yeah. And David is behind you. He's got your back.
Great, thank you. So yes, a couple of things. Let me start out by saying we did go through H703, the sections related to education. We do have a number of suggestions, which Mr. Hall has. I guess one of my questions for all of you is, we'll make the suggestions and you can all, either take them or leave them, basically. I'll take you through the highlights. And the other thing I'd like to say, Mr. Chair, is we are going to hear again from the Agency of Education today.
Okay.
So I don't know what day you're hoping to vote this.
We're thinking Tuesday.
Yeah.
Tuesday?
Wednesday.
So we would just loop back to you with a couple of additional suggestions. But I feel like this is the work that we've done and are feeling like we're in pretty good shape. So You'll notice as Mr. Hall will take you through, we did put a purpose implementation piece here. We just noted that it's the intent of the General Assembly that the recipient of funding through this act shall conduct significant outreach to ensure that all Vermonters, particularly populations that have experienced unequal access to public-private economic benefits due to geography, socioeconomic status, disability, etc., have an opportunity to benefit from the financial programmatic benefits that are made through this. That was a suggestion from Senator Lyons.
So that's like intent language?
That's intent,
Okay.
but again, I feel like that's really all of you, but Senator Lyons brought it up and we put it in there. We also added a section, as Mr. Hall will take you through, that works to get continuing education credits, almost like a bundling process for mental health and substance use disorder professionals. There are a lot of people out there taking a lot of different things. We put some language in there that would sort of allow this kind of bundling so we could get more people certified faster in that area. We also put some language, you'll see some amendments. Some funds have been given to joint fiscal for different projects, but they're really agency of education projects. And so we switched that back to the agency of education.
Right, and did you see Heather's memo to you yesterday? Because
We're
we
gonna-
have her testimony on
Oh, you already have?
that. Yeah, we're on top of it.
Great,
Section 3.
Great. So we're gonna hear from them again, but yes, we agree with at least that piece of it,
Terrific.
sure. You know, as people have heard me talk about this in a number of different committees, and it does have a few different possible paths, one of which may or may not be this, but we did provide you with our language for education workforce development, educator workforce development. As I've said, we have 1,000 openings already in the fall, likely to have more openings for school teachers. We've got to do something. Here's some language that goes to the Agency of Education that would get this kind of peer review process even more robust than it is now. And also reach out to people in schools who might be likely candidates to be and want to be full-time classroom teachers, paraeducators, perhaps administrative support, people who may be close to finishing a bachelor's degree, they need a little bit extra money, they need a little bit of help, and so there's some language in there.
So this is upskilling and continuing education within the education system.
Yeah.
And is this the 750 that you had been talking about?
It is.
Viewed as being paid for possibly out of the 90 million,
The yield, no.
the yield bill. Okay, great.
But we're gonna see if somebody picks it up. Maybe, we've talked to finance, as you know, yesterday, and talked to you, we mentioned it to Senator Kitchell.
That's ongoing base funding, right?
It really is, I mean, it should be. So this would be a one-time appropriation to start to deal with some of these things. We'll come back next year and deal with additional issues related to this shortage, but it's amazing because people will tell you, and school teachers will tell you, like the 90s, you could find a teaching job almost in the United States. It was crazy, incredibly competitive, very few openings. And now, of course, we're seeing it throughout the country.
So
Particularly in rural states.
So you said, somebody said, I thought it was you, Brian, somebody said that like 2 or 3 years ago, you'd have 20 or 30 people applying for a job, and now we're lucky if we have options.
I was in the room when somebody did say that
Yeah.
also, but yeah, so it is interesting. So maybe it was even as recent as just a few years ago that.
Yeah.
But also, we are dealing with COVID, and I have an uncle who just decided not to continue his position as the principal of Hardwick Elementary after a long time, and I haven't really talked too much about it, but I think all of these things coming together, it's hard.
So how, do you know how this was dealt with in the budget, the spending of the education surplus money? Has there just been like a block of that set aside to be determined in the yield bill or potentially in this bill? I mean, we have some education fund spending in this bill for the EHCB and housing construction.
Right.
But I don't know exactly how the budget bills deal with this. Do they just park it for a while, or?
I think it's a combination of parking and recognizing that finance is going to be picking up these things. For example, when I reached out to Senator Kitchell on some of our priorities that I mentioned to both of you yesterday, that was largely because a month prior, Jane said, do it in the yield bill. So she's in contact with finance about whether it's gonna be in the big bill or it's gonna be.
So
That-
if
that
we
helps.
put this, if we put this 750, but had it come out of education fund surplus, I guess what I'm trying to ask, is there room in the budget right now for that money?
There's room in the yield bill, but I don't know if there's money in the budget.
They have
In
anticipated,
the yield bill.
In the bill, yield
Yeah.
bill, yes,
Well,
there's
doesn't
money
that
there.
yield bill ultimately get incorporated into the budget
But
in
I-
terms of balancing the budget?
Yes,
The
yes,
education fund
yeah,
budget.
yeah.
Where's the administration on all this? You know?
So the administration has been supportive,
have you finished the report?
well, let me, no, not quite yet.
So Brandy, do you mind if we just get them to finish, go through all the recommendations and then come back to what the administration supports?
So then finally, and again, David will give you more details. We continue to be concerned with the 15 million that's being appropriated from the Ed Fund to Vermont Housing and Conservation Board to create and administer the CET construction rehab experimental learning program and revolving loan fund. It's not, I guess our concern is we want to make sure, and maybe we need to keep digging into this, you may all already have the answers. We just want to make sure that this is going to address middle and low income housing. You know, we want to make sure that there is a component to that, and we haven't dug in too deeply, all of you may have, but we just, maybe it's might even be silly to think that these dollars would be going to, you know, help a more wealthy family renovate or flip a house, or they're renovating houses that would then be flipped in wealthy, more upper middle class families would buy.
So I can allay those fears
Okay.
in a couple ways.
Yeah, because
This
we've
is
heard
not,
from,
this is not a housing program.
Yeah.
This is an education program.
Okay.
And I'm kind of surprised that the education
Yeah.
committee is concerned with what kind of housing is built as opposed to.
Fair enough. Fair enough.
As opposed to what the education, I could really, I mean, I do have some concern.
Yeah.
As how many houses they're capable of building and how many people are going to
Yeah.
get trained. And that thing, I think we should be in alignment. I welcome your suggestion on the CTE programs, but it's really, it's a second, the number of houses are going to be so small that whether they're perpetually affordable, it'd be nice, but
Yeah.
the main focus of this is education.
And I
We
appreciate
have a lot
that.
of
Yeah.
other things on
Yeah,
housing.
yeah, and to be honest, we really, our intention in no way was to sort of muddle in your work. It was just a question that's come up now a few times. It's a very dynamic, smart committee next door. We have good questions.
You have a beautiful room.
It's a fantastic room, with a fantastic chair.
You know, most of the education though is in doing gold elite application and the construction of elaborate moldings. That's what they're doing.
so we, to further allay, we have spoken to a couple CTE directors,
Great,
AOE and VHCB on this.
Great.
It is really, and I think we feel that this is I mean, I'm not sure we feel it to the tune of 15 million.
sure.
But I do think we feel this is a huge educational opportunity for our
Right.
CTE students.
No, we did as well,
Combining
yeah.
and working with other populations so that
Yeah.
they would also be learning from other adults, because we
Yeah.
could be looking at adult CTE on this, and adults could be helping build these
Yeah.
and renovate blighted and vacant properties also. In their
No,
community.
without a doubt, the educational thing is very interesting, exciting.
It's huge, and it would support a number of CTE construction programs that already exist. And so are those the key elements?
Those are the key elements. So Senator Brock, to answer your question, we had the administration in, didn't have them in for all of the different pieces. For example, and I would respect if you and the chair feel as though we've stepped over the line, but you know, when we put our perk added to the purpose, we haven't had them in. What we have had them in to talk a lot about, and we're having them in again today, is the CTE piece and the part regarding teacher hiring, or you know, the teacher workforce. And I think we're at a good spot with them. Initially, initially this was an idea from the NEA. The agency was concerned about how the money was going to go, et cetera. We directed it directly to the agency, and we kept it, I think, broad enough where they can do this work with either on their own or with the help of a
Is the teacher recruitment, sorry,
No, I'd just like to tag on to the agency. The AOE is very supportive of the rework in section 3 too. So we heard the agency and the administration being supportive of that piece. Sorry.
so the 1,000 teacher shortage, in terms of addressing the 750,000, is there specificity that we're going to see from David Hall's language as to how that money can be used, or is it just a pot of money given over?
Yeah, there's some specificity, but you'll see we kept it pretty broad so there could be some flexibility. Really, we would see these dollars going to teachers and schools that might serve as mentors. Some of the monies would go to taking a class here and there to finish up, supporting your tutorial or whatever you might need for your exams. Those are the kinds of things that money would do it for.
One of the things we're not, I don't know if you've gotten into this, but we're not seeing with great specificity in the House passed version of this bill is like pro formas, how they came up with 150,000 or $1 million, or, it's very, it seems like it's somewhat arbitrary knowledge there. Suggested, do you have a breakdown?
Yes, so I can share that with you. It's on our website, and perhaps your committee assistant could ask Daphne for it, if he doesn't mind. The proposal came from the NEA. This would get us the 750, would really work to get us about 150 more teachers that aren't in the workforce right now in the workforce. So they gave us this number based on that, and they have that breakdown. At one point, we felt we might consider doubling it, which would give us 300 teachers, but right now we felt for now, do this, and as you'll see in the language, we'll have a check-in next January to see how it's going.
This is from surplus ed fund, right?
That's correct.
So this is in competition with, but on a much smaller scale.
Much
with-
smaller
with
scale.
The construction and the
Yeah.
nutrition programs.
Yeah.
So
Much smaller scale, yeah.
I'm just going to tag on to this 750 because it strikes me that I heard you saying this bill with this modest amount of money is expected to upskill people who are already in the education workforce somewhere, upskill continuing education, and recruiting new teachers. Is that the 3 expectations? So it does, and the need is 1,000.
And we know some of that will happen on its own, yeah.
Okay, so I guess one of my questions is why not more money? And because that's 3 big things. Recruiting new teachers is a big marketing.
And that's largely where I think the agency and others in the NEA felt it's a big job, and to really tackle, to even get 150 started. I mean, I'll be honest, I don't think those 150 are gonna be, I don't think we're gonna see that really in September. I think that's some planning going forward. And so then I think we would be back to see how it's going. And this is a peer review process. Let's see, even if that's working well, there might be another approach out there.
Okay, so you feel this serve as a pilot. Maybe we could talk about it as a pilot.
Sure. Talk about it as a,
Continuing.
yeah, absolutely.
And did
All sorts of words you could use for this
Did-
one.
VSEA have actually a plan for recruiting? I mean, that's,
Yeah, they did this as a pilot. This is something that we're kind of building. If the NEA were asked to participate, the NEA has done this work in the Northeast Kingdom. And so they've had some success with it.
Oh, they have?
They
Oh,
have,
great.
yeah.
so this is expanding that.
We call it an expansion of a pilot. A pilot expansion. Or just a pilot or an expansion. I mean, there are the options, and this is where Ledge Council is going to get in really helpful.
Titles are everything.
The titles.
Right.
All right, I'll be
Okay.
back tomorrow.
Do we have any other questions for Brian?
God, I hope not. No, I'm kidding. This is great.
Well, I mean, I guess I do,
Yeah,
now.
please, of course.
Go for it, that's why we're.
Just in the big picture, $15 million is a lot for this program to
It
create
is.
houses. We have competing needs for surplus dollars in the
Yeah.
ed fund.
And I'm sorry, Senator, is that where this 15 would also come from?
Yes.
This is also yield bills,
All
all
yield.
of this,
This
okay.
is yield.
Well, no, this is the House
says-
came with this bill, but it's from the ed fund surplus.
Yeah,
So it
it
is.
says, it says
Okay.
from the ed fund, so I don't know, but
Okay.
I'm assuming. So that just says to me, like, do you believe that that $15 million is the highest best use for workforce? Because I think we have established it probably won't build a lot of housing. So
Right.
it's not like the ed fund is contributing to housing homeless kids here or
Right.
something, you know, it's a big chunk of money and we haven't talked about the actual amount. And if you
Yeah.
think shaving some of that money off to add to addressing the teacher workforce shortage or other issues is just
Thanks for the question.
important.
Yeah, and I'm happy to share with this committee the memo that we shared with finance. Our big things are PCB mitigation.
Yeah.
46 million. Teacher shortage and school construction.
Right.
I mean, those are our big things. We continue to say, or at least I just speak to myself, one-time funds for universal meals. I know people want it. One time without some plan for the future, I think that doesn't. So I realize that doesn't make sense to me,
Yeah,
but I understand there are a lot of competing factors.
okay.
So those are the big.
Should the $15 million go toward teaching students how to construct schools?
Well, we did put some language, as Mr. Hall will talk
Okay,
about, could any of these things be directed even to?
yeah,
You have HVAC in there too as well?
Yes.
We put 5 billion for HVAC, yeah.
That's a priority.
I still come back to the issue of what's the administration's position, because the governor's position in starting this was to take half of the education fund surplus and return it to education taxpayers and use the other half of it for CTE. It was very simple and straightforward. He emphasized that on and on and on and on. So I'm just wondering, has there been some change in the outlook?
Oh.
Do they understand that it's the intention of this to use the ed fund surplus to pay for this?
So thanks for that question, and I apologize if I was, yeah. So we haven't had the conversation. The administration, I would say, does not support where we were thinking about school construction money set aside. I don't want to misrepresent, I'm not sure where they are on the PCs. I think they generally support a move in the direction of, on these issues, but I can't say with certainty that the administration thinks that's going to be where they think the real dollars should go. And so, in fact, we had Secretary French yesterday when I was in finance. Now, part of that I thought was, we would like to put some serious money aside for school construction. He does not believe that's necessary at this point, but we see this as an opportunity with the surplus, and we know that there's a lot of buildings out there that need it. So I would say, on the PCB Park Center, I don't know if they've really taken a position. They've been helpful, they've been supportive, they've been in to talk about how testing is going. But I don't think we've asked them specifically if they.
Yeah, that
Well,
was
DEC
41
came in,
million,
that's the number from DEC.
Yeah.
Well, it's 45 million, right?
I think it was 45, 46. But to be clear, we never said, do you want this to come from the ed fund? We said, what's the number that we're looking at in these early days for assessment mitigation?
I think they are supportive of the 50 million administration.
Yes, they are.
Of the what?
Teachers.
It comes from someplace.
It's their idea.
No, you said
Oh, yeah.
The governor.
half
From
from,
half of CTE.
that's a CPE
Yeah,
program.
so
but
consider CTA.
That's what it is. That's what it is.
So what it looks like is, my question is, of all the CTE money spending, are we spending more than half of it? Are we getting into the
Well,
quote?
in our bill, we're only spending 15 million.
Yeah.
So,
And it's not funded out of this bill, it's funded out of the yield. The excess, the ed fund excess. But it is a governor's recommend for the excess, for the education fund excess.
so I don't think in this bill,
Yeah, I'll go.
in this bill, I think the only thing that's coming out of fund surplus is that 15
Is the
million. And that's way less than half. of what-
And you envision the HVAC upgrades for schools also from the yield bill.
5 million, we said, fine.
Do you know whether the governor had any other proposals for CTE for education? If he says he wants half of the money to come from there's $90 million, right? So
Right,
$45
right.
million, presumably, there would be a suggestion for continuing, for career advancement education.
Over the surplus, yeah, it was 15 million to fund the CTE construction,
That's it.
rehab, experiential learning program, and for the revolving loan fund.
Right.
28 million competitive grant program for CTE facility and infrastructure upgrades, like expanding classrooms, purchasing equipment, and increasing access to
And that's
programs.
capital, that's school construction.
Yeah.
That's just,
Right.
that's for CTE centers.
That's CTE.
And is that anywhere floating around in the institutions bill or someplace else?
But we do have meetings coming back in this afternoon just to talk about the amendments, suggestions that you've all already seen. And we're happy to.
Can you help me understand,
Yeah.
I should know this from finance, but can you help me understand, I understand that the property tax reduction
Yes.
is going down, what, like 16 cents or something like that?
Well, it's 10 million per penny, so it can't go down more than 9 cents.
You said 6 cents, did you, or 16?
16.
Oh, I thought,
Yeah,
I didn't know.
I don't know how that.
Well,
works.
how much, do you know how much is being projected, like, say, the governor's plan for property tax reduction in terms of millions of dollars?
I don't know that. That would be misleading, yeah.
Well, he's asked for 45 million. That was his ask, the governor's ask was 45
His
million.
ask is half.
Yeah.
To go
Yeah.
into. And the problem with that, Randy, that I have is that we then, because it's one-time money and property tax is an ongoing expense, then we get jackhammered right back up. It's, it just, to me, that's just a brutal waste
I'd
of.
rather have $1 today than a hamburger tomorrow.
Ah,
Well, I'd rather have, I guess I have many things more
That's what Whitney
discipline
said.
than
right.
that. I,
Okay.
I only have another 30 minutes. Any other questions?
no, thank you very much. You're between us and a break and the loo.
Yeah.
What about Dave?
Oh,
Yeah,
David
David's-
Hall,
yeah,
do
I'm
you
out.
have?
Thank you.
Thank
Thanks,
you.
Brian. I
Thank
appreciate
you,
it.
Brian,
Thanks,
thank
everybody.
you.
Thanks a lot.
David Hall, do you have anything to weigh in with us on, or to share some of this language, or?
That's up to you guys. I can certainly take you through.
No, because we're gonna go on a break in 2 minutes, but if you have language for this,
Yeah.
that, if you'd send it to Scott, we can, or to
Yeah.
all of us, that would be great, to
I can
Scott
send
and
it for the
all
whole
of us.
committee.
And David, are you able to stay, come back with us at 10:45 to join us, or your intern who drafted the next proposal for us to consider?
I have not spoken with her at all. I have no idea what her schedule is. I have to go to Commerce.
Okay, can you get her, do you have her name, Scott? Would you send Scott her name so we can invite her to join us? It would be great to have somebody with us, as I think I mentioned in my email last night. If you could send Scott her name and email, that would be great.
I don't know if she's necessarily prepared to appear before a committee.
Oh, okay. Okay,
Yeah,
well, we'll do
I'm-
our best and hope that we can book you next Tuesday between 9 and 10 maybe. Because the rubber's beginning to hit the road on H703, and we're gonna need to start pulling some of these pieces together. And so maybe David, you and I can speak on Monday about the pieces that we're gonna pull together for the next draft.
Yeah, that sounds good.
Okay, great.
All right. Okay.
Terrific. So we'll get, here's the language. We have it. We got it.